Good evening, everyone. It's Wynn Brown here for our now daily COVID-19 update for Haywood Healthcare. It is Wednesday, April 29th. A little late to you this evening. I'm sorry again. We had actually a long call, or a good call, with our medical group today to talk about what's going on at Haywood Healthcare. And I think you should all be just so proud of the amazing physicians and providers we have in our community. And I'm very grateful to their support in everything that we're doing right now, and the great care that they're providing and how they're stepping up. So a shout out to our medical staff, and if you are friends with any of them, or hopefully you all have one of them as your physician, please make sure that you thank them for the great work they're doing on many fronts today. Let's look at our testing results so far. We have tested 2,209 patients, 1,737 negative results, 337 positives, 25 indeterminate. That puts our rate down to 16.2% versus the state rate at 22.9%. So again, we continue to perform better than the state on that. Just in Worcester County, 4,999 cases. So 5,000 cases, 229 deaths. In Franklin, they have moved up to 237 confirmed cases with 33 deaths. So again, if you were watching any of the statewide figures today, again, we still continue an upward trend. While not precipitously upward, we continue upward, and so we need to shelter in place. We need to do all the things that we're doing. You've seen the governor has asked us to stay a stay-at-home order until May 18. So let's all do our part and continue doing our part. At Haywood Hospital, we have 7 positive patients, 1 in our ICU, and 4 patients under investigation awaiting their test results. So some big thank yous today. One is to Doug Starrett and LS Starrett and Company, and as you know, and I've mentioned before, they've been supporting us along the way, and obviously our new emergency department is named for them at Athol Hospital. And a few weeks ago, Doug said, you know, I have a facility over in China. Would you like me to try to get you some masks? And yes, he did. And 8,000 face masks arrived today at Athol Hospital, isolation masks, so surgical masks. Thank you very much to Doug and the whole Starrett family and employees for the great work you're doing to support us. That really is just an amazing, amazing gift, keeping us Athol and Haywood strong. Also, we got another delivery from Ford Motor Company. Almost makes me want to go out and buy another Ford right now. So they delivered another shipment to our campus today. And Kathy Graves cut several gowns for us with materials being redeployed to our sewers so that they can sew them. And we appreciate that. As you know, I've said it many, many times. Gowns are like gold to us right now, and they're very hard to come by, and they are incredibly expensive when you can source them. So thank you very much to our sewers out there, especially those who are working on gowns for us right now. I also shared a couple weeks ago that we were starting just a weekly drawing of swag for our employees, just a drawing to thank folks. And so this week's Haywood Strong Apparel raffle winner was Alyssa Berry, and Athol Strong Apparel raffle winner was Ross Aries. So we'll be delivering them some nice Haywood Strong and Athol Strong apparel. And also Catherine Whitaker, who is our nurse practitioner in our occupational medicine program. Congratulations to her. She completed her scholarly project presentation last evening via Zoom, and she will receive her doctorate in nurse practitioner for graduation on May 28th, and she completed a challenging project on advanced directives. At the same time, she was helping lead us through COVID-19, and so some of you saw her as a guest star on this a few weeks ago when she was giving some updates to everyone, and so congratulations to Catherine. And then Haywood Warriors, we received consent from one of our discharged patients to share her discharge video with the public. Deborah is 61 years young and a champion of the COVID-19 battle. And so enjoy that video that's embedded in the email tonight. Thank you for all you're doing as we continue our journey to be one of the best community-owned health systems in America. I wish you a great evening, and I'll be back to you tomorrow night, and we'll talk about how the day went and what it looks like ahead. Take care.